The today's topic of our discussion is uh, clinical uses of sulfonamides. Clinical uses of sulfonamides. The first clinical use of sulfonamide is urinary tract infection. Urinary tract infection. Urinary tract infection. Urinary tract infection is uh, treated by sulfonamides. And one of the example of urinary tract infection is prostatitis. Prostatitis. Prostatitis is the infection of prostate gland. Infection of prostate gland. And it is said that from all the antibacterials and antibiotics, sulfonamides from all the antibacterials and antibiotics, sulfonamide has greater penetration in the prostate gland from all the drugs used to treat the infection. sulfonamides जो है ना वो सबसे ज्यादा जो है उनकी penetration है किधर प्रोस्टेट ग्लैंड, ठीक है, और इसलिए सल्फोनामाइड्स को प्रेफर किया जाता है फॉर द ट्रीटमेंट ऑफ द prostatitis. Okay. Second clinical use is, and the drug used in the prostatitis is sulfamethoxazole plus trimethoprim. Sulfamethoxazole plus trimethoprim. Okay, and it's a famous drug. It is a very famous drug, that is Septron. Okay. Second clinical use. Skin and skin structure infection. Skin and skin structure infection. Infection. This is the second clinical use of the the sulfonamides. As you people have seen कि जब किसी बंदे को फोड़ा वगैरह नहीं निकलता, pustules वगैरह, तो वो usually prefer these sulfonamides. And the brand which is more commonly used for skin and skin infection is Saffron also. Okay. Next clinical use is toxoplasmosis. Toxoplasmosis. Toxoplasmosis, it is some sort of diarrhea which happens because of the food poisoning. तो food poisoning की वजह से होता है. And the causative agent for the toxoplasmosis is Toxoplasma gondii. Toxoplasma gondii. And the drug which is used for this disease is sulfadiazine plus pyrimethamine. Sulfadiazine plus pyrimethamine. Okay. So this is the third clinical use of sulfonamides. Fourth clinical use. Malaria. Malaria is also treated by these sulfonamides and in combination, as we all people know that sulfonamides and these pyrimethamine or trimethoprim is used in combination with sulfonamides. So the combination which is used for the malaria is sulfadoxine, sulfadoxine plus pyrimethamine. And the brand of this sulfadoxine plus pyrimethamine is Fansidol, which is very famous drug used to treat malaria. Fansidol. Next clinical use of sulfonamide is conjunctivitis. Conjunctivitis is the infection and inflammation of conjunctiva of the eye, okay, which basically burns the eye. And the causative agent for conjunctivitis or Chlamydia trachomatis, C. trachomatis, and Neisseria gonorrhea. Yes, Neisseria gonorrhea can also cause not only infections related to the reproductive organs, but other organs can also be infected by this Neisseria gonorrhea and gonorrhea. And the drug which is used for the conjunctivitis is topical used, that is sulfacetamide, 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 and it is topically used to treat conjunctivitis. Okay. As we know, sulfacetamide only used topically because its absorption through GIT is very less. So that's what is used as in the topical preparations. So these are the five clinical uses of the sulfonamides. Come towards next, ulcerative colitis. Ulcerative colitis. It is the infection of the colon, and the drug which is used for the treatment of the ulcerative colitis is sulfasalazine. Sulfa, sulfasalazine. As we know, sulfasalazine is less orally absorbable drug in the sulfonamides. कि इसकी एब्जॉर्प्शन कम होती है, इसलिए इसको अल्सरेटिव कोलाइटिस में यूज किया जाता है, क्योंकि जब एब्जॉर्प्शन कम होगी तो इट विल बी available for the longer period of time in the colon to treat ulcerative colitis. Okay, available for longer period. And yeah, so that's why will be used for this ulcerative colitis. Next clinical use is shigellosis. Shigellosis. Shigellosis, it is also the disease associated with the GIT, and the positive agent is Shigella. And the drug is used this sulfasalazine. The rocket science is the same because it is less absorbable. So that's why will be available for the longer period and will kill this Shigella bacteria and will treat this shigellosis. Sulfasalazine. Next clinical use. Burns infection. Burns means in case of burns. Why in case of burns the sulfonamides are used? Because then uh, somebody somebody's skin gets burned because of any reason, या भी किसी बंदे की स्किन जो होती है ना वो जल जाए, तो वहाँ पे जो है ना बैक्टीरियल जो ग्रोथ है या वहाँ पे जो बैक्टीरियल एक्सपोजर होता है वो बढ़ जाता है, ठीक है। इसलिए those bacteria might reduce the process of healing of that burn. So that's why we use some drugs to prevent the growth of bacteria at that site of burn. ठीक है, उस जगह पे बैक्टीरियल की ग्रोथ को कम करने के लिए हम वहां पे लगा देते हैं ताकि जो हीलिंग प्रोसेस है ना उस वो प्रोलॉन्ग ना हो जाए. ठीक है, तो द ड्रग विच इज यूज फॉर दिस इज सिल्वर सल्फाडाइजिन. सिल्वर सिल्वर सल्फाडाइजिन. Okay, is used for the burns. And the very famous uh, brand name of silver sulfadiazine is Quench cream. Quench cream. Okay. Next clinical news. No cardiosis. No cardiosis. Nocardiosis, it is the disease which is caused by Nocardia species. Nocardia species is a group of bacteria. Nocardia species. Okay, and mainly they affect the lungs, affect lungs, skin, and brain. And the drug used for this is Septron or sulfamethoxazole plus trimethoprim. Sulfamethoxazole plus trimethoprim. Next, clinical news. Pneumonia. Pneumonia is also treated by sulfonamides. No, sulfonamides are not commonly used nowadays for the treatment of pneumonia because of other more safer and good options for the pneumonia. So sulfonamides are not used nowadays, but these can be used for the treatment of the pneumonia. So if you enjoy the lecture, please like, subscribe, and share.